Good morning, class of 2025. Third period, of course. Today, I'm your host, Kenneth Hernandez, and I'm going to give a speech about the evolution of Medicaid and Medicare since their inceptions. I'm going to talk about history and the evolution of two important groups in the United States, of course, Medicare and Medicaid. These programs have helped millions of Americans get their health care they need, but they didn't start as we know them today. Well, we're going to take a look where they came from, why were they created, and how they changed over time. For that, we got to go back to the future, 1960. During this time, Americans were going through major changes. The civil rights movement was in full swing. The people were paying more attention to issues like poverty and inequality. One of the biggest problems was the lack of affordable healthcare, especially the two groups, seniors and low-income families. Many elderly people who were no longer working couldn't afford medical care. But as well, the low-income families also struggled to get health care, but mostly insurance, too tired to jobs, and not everyone had access to paying good work. Well, President LBJ wanted to fix this as a part of the Great Society. He planned to reduce poverty and improve inequality. He introduced the Social Security Amendment in 1965, which created Medicare and Medicaid. These programs aim to give health coverage in elders and poor, two of the most vulnerable groups in the country. Now we're going to take a look at Medicare and Medicaid and why were they created and what was it supposed to do. Medicare was set up to provide health insurance of people aged 65 and older. The idea was that after a lifetime of working, elderly Americans shouldn't have to worry about paying for health care. At first, Medicare, the two-part, which was Part A, which covered hospital care, and the Part B, which covered visits to the doctor and other medical service. Now let's take a look at Medicaid. Medicaid was created to help low-income people, including families, but as well as the children, to get access to health care. Medicaid, as a joint federal of the state program, which means both the federal government and the federal state help pay for it. States also had some freedom to decide how they ran Medicare. Within certain guidelines, over time, Medicare was grown to coverage more people, including pregnant women and as well people with disabilities. But yet, of course, since the 1960s, these programs have gone through many changes. Now, let's go past the 1960s now to 1970. Medicaid was explained in 1970 to cover people with disabilities and those within kidney failure who needed long-term treatment. In the 1990s, Medicare Advantages, or Part C, some people called, was introduced. They give seniors the opportunity to get their Medicare benefits through private insurance plans, but as well offering more choices. Now, fast forward to 2003, Medicare Part D was added to help cover the cost of prescription drugs, but as well, which was a big step forward. Medicaid also had changed a lot. Now, fast forward to 1977, for Medicaid and children health insurance programs was created to cover children in families that didn't qualify for Medicaid but could afford private insurance. Now, fast forward that to 2010, the Affordable Care Act explained Medicaid to cover millions more low-income adults, though not all states adopted the expansion. Now, today, Medicaid and Medicare together provide healthcare more than 130 million Americans, from seniors and people with disabilities, low-income families, and children. These programs have grown and adapt to meet the needs of the changing population, but as well, there are still challenges. Rising health costs and aging populations and ongoing political debates about funding and coverage make the future of these programs a topic of continuing discussions. And that wraps it for Medicaid and Medicare. Hope you learned something new. Your host, signing out.